Good afternoon. My name's Dr. Dustin Blackwell. I'm an obstetrician and gynecologist at Good Samaritan Hospital in Vincennes, Indiana. The reason for this video today is we've received a lot of sources and a lot of videos have been out there regarding the recent outbreak of coronavirus. And we've received a lot of questions, concerns, and worries regarding the virus and how it may affect pregnant women and their intrauterine gestation during this time. It creates a lot of worry and anxiety, and I'd like to clear some of those both true statements and sometimes false statements that you may see out there from different outlets. First and foremost, the American College of Obstetrics and Gynecologists and the Society for Maternal Fetal Medicine came out with a practice advisory recently, and they have mentioned specifically that there is no increased risk to the pregnant population regarding severe disease if one would contract the coronavirus. That being said, multiple outlets out there have said that pregnant women are at increased risk, and the reason for that is probably due to the underlying nature of influenza and the SARS virus in recent history that have made a pregnant woman more susceptible to those viruses, and they are known to get much sicker if they would contract one of those viruses. As we know right now, the studies out of China and small case studies have shown that, again, pregnant women are not at increased risk and of severe disease if they would contract the virus. Now, if one would contract the virus, there have been rare reports of preterm labor, although they don't know that that's directly related to coronavirus, and I will get to that in just 1 minute. To this date, no infants have tested positive for coronavirus who were born to affected mothers. There's still ongoing studies and research regarding this, but to date, if a mother is infected with coronavirus, there's been no reports that infants have been affected by this. As well, there's been no evidence that coronavirus can be submitted through breast milk or through the amniotic fluid in which the baby is living in. So we still encourage breastfeeding if a mother is interested in that, and very low risk of transmission with that. What to do to best prevent coronavirus at this point in time, as we all have been discussing, great hand hygiene, normal things to help prevent spread of disease, covering a cough if you have one. And if you would develop symptoms, you would just self-isolate for the most part. For pregnant women specifically, if you would develop a fever with any of the concerning symptoms regarding the coronavirus, including cough and shortness of breath, it's best to call either the triage centers or your provider to go through those symptoms. The only reason that concern would be brought up with a pregnant woman regarding contracting or concern for coronavirus would be symptoms of severe shortness of breath, unable to catch your breath, feeling dizzy, lightheaded, unable to keep anything down. Those would be concerns to call in immediately and get immediate assistance. Other concerns would be if you had underlying health conditions that would make you more susceptible, such as diabetes or history of preterm labor or immunocompromised of any state. Then that would be another reason to call a physician or a triage line to see if your symptoms would mean anything in regards to that. This is all based on a specific algorithm, like I said, from the American College of Obstetrics and Gynecologists, and they mark out specifically which direction to follow. That includes all pregnant women that would happen to have a fever and or a mild cough. If that's the only symptoms that you're having, they recommend, due to the fact that there's no increased risk of severe disease, self-isolating, staying at home and practicing those good hygiene is the best thing to do from that. For any more information that you would have or any other questions, I would really strongly have you go to the CDC website or go to the American College of Obstetrics and Gynecologists. That's acog.org. They have a great practice advisory and that algorithm that I had mentioned to kind of follow along with, and they have direct links to the CDC on frequently asked questions, and that's really the best source to get your information at this difficult time. There's going to be all kinds of sources and maybe new information coming out, but this is what we know right now to have an effect on pregnant women and their infants or intrauterine gestation. I just want to say that we're always here for you. If you would happen to be affected or have family members affected, we best wishes for them to a quick, healthy recovery. And if you have any further questions or need clarification, we're always available in our office and through our Good Samaritan website. Thank you very much, and we'll be seeing you.